Here we're in the Smart Inbox by eConsult. See the practice that we're involved in here and the user in the top right corner. In this case, we're going to show the interoperative matching of cases to the operating system. In this case, we've got all open eConsults, clinical eConsults, and here we can see 2 eConsults that have been triaged awaiting action and completion. In this case, we're going to look at Bart Simpson. We can see that Bart Simpson has had a blood pressure review, submitted some readings, and it's been triaged by a clinician as a practice nurse in 4 weeks, requiring a text message. And there we can see it's been triaged. The GP's left a note saying, "Nurse, please code and text patient regarding their BP monitoring." And as anyone clinical would be able to tell, this is a normal BP reading, just needs updating in the notes and remotely closing as the GP's indicated here. In this instance, we need to match the case. You can see that the Smart Inbox has recognised several fields that match with the patient in EMIS, and therefore I'm happy to proceed and match this patient with the patient in the EMIS record. You can see that we manually match that case. I can shut that now, and we can see we've moved from amber to green. I've now got the option to save to record, which I'll select. It's saving now. And once saved, it will appear in the EMIS screen underneath the Smart Inbox at this time. We can see it's saved to record down here. I can reload the patient's EMIS notes, and I can see the details of the eConsult file that's been saved to notes. And if I were the admin staff, I might choose to send a task to the practice nurse to review this, and that would be the case closed. So I'd go back into the notes. I'd select complete. I'd put a note, save to EMIS and nurse informed. Save. And we can see it's moved from the triage box to the completed folder. If I ever wanted to come back and this box was very busy, I of course could use the search tool to search for Bart Simpson, and I'd see a full audit trail and why the appointment had been booked in the way it was, so the nurse may pick to do that once they receive the task.